So here's an interesting concept to kind of consider. If we're thinking about the overextended or the hyperextended athlete, somebody who kind of walks around with this big, tall, proud chest, they might have kind of this, what looks to be a protruding gut, when in actuality that's just due to their pelvic tilt shifting their ribcage open. But if you notice in those athletes, a lot of them have overactive lats. And with those lats, what's going to happen is it's going to pull their shoulder blades down into depression, but it's also going to then cause them to arch. So as we know, the lats connect at the humerus, and they are a strong internal rotator, but they also connect to the thoracolumbar fascia on your lower back. So because of that, if they become active, they're going to pull one into extension. So that's one of the reasons why I like double or even triple as many horizontal rows as vertical rows for these overextended athletes, and subsequently reducing their vertical pull volume. One of the other things that you need to consider is with a horizontal row, if that individual has overly active lats, what they're going to primarily feel then during any sort of horizontal rowing motion are those lats turning on for shoulder extension. Now, it's not to say that the lats should never function during a row, because that's not true, but we should be able to feel the upper back engaged during a row. If we can't, then there's two things that we need to kind of consider and think about, or the first two things that we need to kind of consider and think about. The first is your breath. And essentially with an overextended athlete, if you have a flat thoracic spine, you're not going to have a very stable base for your scapula or your shoulder blade to sit on, given that shoulder blade is curved. And if you flatten the thoracic spine, the two aren't very congruent. And as we know, position affects activation. So if you're taking a joint, quote unquote, in this case, the articulation between your shoulder blade and your rib cage, and we're flattening out one surface of the joint, in this case the thoracic spine, now we basically change the positioning of the muscles of the scapula relative to the rib cage, if that makes sense. So because of that, if you're a more hyperextended athlete, one thing that you may want to consider is during your rows, when you're going to take a breath, you may want to take the breath before you actually pull the stack off, because once you go to lean back here, you're going to be a lot more extended as you're fighting that anti-flexion moment from the weight. So you want to kind of take your breath, not an overly kyphotic position, but you don't want to be here when you take your breath. You want to try to be a little bit more neutral. Breathe in, and then come back and start your set. The other thing to consider is because my shoulder blades may be depressed as an overextended athlete, if I present as somebody whose clavicle angle is flat or even negative, and normal is anywhere from 6 to 20 degrees of incline or slope. So if you present with that depressed scapula, one of the things that you may want to consider is actually a slight shrug before you take in the breath, and then throughout the motion, focusing on maintaining an active shoulder. What I mean is, like, if you're thinking about like a farmer's walk, you never want it to pull you down to the point where you can't maintain that active shoulder. It's not to say you have to shrug, but you just need to maintain an active, stable shoulder. Well, it's the same thing here. What you may find is that if you've got the weight stack in hand, or excuse me, the handle in hand, you may actually have to just shrug just a little bit, get your air, and then row. And now because you've essentially elevated that rib cage just a little bit to allow yourself to get a little bit more airflow, that'll help to inflate that upper back, give the scapula a stable position to sit on, and then you may feel that that upper back turns on a little bit more. So what I mean is, looking at it from the back, when I go to make my row, instead of keeping my shoulder blades down, I'm just going to simply elevate them just slightly. I will get my breath, and then go through my set. So it's just a couple little things to think about the next time you're rowing if it doesn't really feel right in your upper back, you can't seem to get your upper back to get a decent pump during the set, that's two different things that you should try out: the breathing as well as the slight shrug during the movement to see if that improves your upper back contraction.